This is my doctoral capstone project, the development of caregiver education for infants with neonatal opioid withdrawal syndrome. Neonatal opioid withdrawal syndrome, also known as NOWS, is a condition that occurs in infants after birth as a result of the discontinuation of opioid delivery through the placenta to infants in utero. And NOWS is a relatively new term. Previously, it was used as neonatal abstinence syndrome, and this term still exists, but NOWS is specifically for infants withdrawing from opioids. Symptoms include sleep disturbance, difficulty feeding, vomiting, and irritability. It is important to know that not every infant who is exposed to opioids in utero will withdraw when they are born. Somewhere between 30 and 80% of infants exposed will withdraw, and that is a pretty wide range. So every infant that is exposed shows different signs of withdrawals and can withdraw differently. The site that I was at, if the infant was exposed to opioids or substances while in utero, they were placed on a 5-day hold in the postpartum unit. And if the infant was unable to be consoled and unable to sleep and unable to feed, then they would go to the NICU for pharmacological treatment. But there were infants who were exposed and they stayed in the 5-day hold and then went home with their caregivers. So not every infant will need pharmacological treatment, and not every withdrawal looks the same. My project aimed to help create discharge education for both caregivers of infants diagnosed with NOWS, the ones that come to the NICU, and those without a diagnosis. My capstone site was the University of Cincinnati Medical Center, UCMC, and it is a hospital located in Cincinnati. They have a level 3 NICU, and the mission of the NICU is to promote developmental and family-centered care for the babies, and the therapy staff tries to do this through a developmental care committee and providing education to staff and parents in the NICU. Through interviewing staff in the NICU, I learned that there is a need that specifically exists for infants with NOWS. At UCMC, most of the infants with NOWS have polysubstance exposure and experience different levels of withdrawal. And not every infant is withdrawing the same. And these infants are more difficult to feed, console, and are at a higher risk for neglect and abuse. The first few weeks at my capstone site, I interviewed different staff in the NICU, and this included 2 neonatologists, a social worker, a pharmacist, discharge coordinators, and bedside nurses. And I asked these different disciplines what their experience and perspectives were working with the NOWS populations, and what specific challenges they faced, and what support they could use through a doctoral capstone project. And what I learned through these interviews is that 75% of the NOWS babies at this hospital go home with foster care, and that this discharge can happen very rapidly within 24 hours. And in the NICU, regardless of the diagnosis, the nurse is the responsible party for giving the parents or caregivers of the baby education before the parents take the baby home. So they already have set information they need to go over with every parent who is a NICU parent, and this can take hours. And the goal is that they'll receive this education throughout the baby's stay, but some parents are unable to come in frequently because they have other children at home or they have to work. So sometimes this education happens the day of discharge. And so with the NOWS babies who go home with foster care, since it can happen within 24 hours, typically all of this information is being given to the foster family the day that the baby is being discharged. And this is typically the first time the nurse has met the family. And so this provides a delicate window where the nurse is able to give information to the family, but typically therapy isn't able to get in with the foster family because it happens so rapidly. And due to that, I saw this need for foster families and caregivers of the NOWS babies to have resources that they could take home, so that are from a more therapeutic perspective and touching on subjects that therapy would touch on if they were able to with these caregivers and these families. And I learned that there is no specific discharge education given to these families taking home NOWS infants that's different than any other infant discharging in the NICU. So from this needs assessment, I was able to put together my project. The purpose of my doctoral capstone project aimed to create educational resources for caregivers of infants with NOWS to help them transition home and receive the best developmental care possible. The Kawa model served as the theoretical framework for my capstone project. And the goal of the occupational therapist in this model is to help maximize life flow. And this model helped me with my needs assessment to examine barriers and supports NOWS caregivers have and create educational materials to help meet these gaps. I also use the lifespan frame of reference to help guide my project, and this frame of reference recognizes that people develop at different rates, and the previous stage of development is needed for the next to occur. And this guided my project by helping me develop topics for my resources and to determine developmental barriers such as torticollis and SIDS and ways to aid development such as positioning and tummy time and calming strategies, which helped me create my resources. The outcome measure that I used in this project assessed the nurse's perspective of NOWS education that caregivers received. And this was a simple Likert scale that I created on a scale of 1 to 5 to see how adequate the nurses believed the education was that caregivers currently received on certain topics. And I used convenience sampling based off of the nurses that were available to complete my survey on the day I was doing my pre-survey. Here you can see my pre-survey results. I had 22 nurses complete my pre-survey, and they answered on a scale of 1 to 5, 1 being no education and 5 being adequate education. And my column on the right is the average of their responses. So I asked the nurses how they perceived the caregiver education that NOWS caregivers were currently receiving on these topics. So, for example, for tummy time, 4 nurses answered that caregivers received no education on tummy time. 9 believed that they received little education. 2 were unsure. 5 believed they received some education, and 2 believed they received adequate education. And the average was a 2.6. So on average, the nurses believed that the caregivers got between little and unsure education on tummy time. Based on the results of my pre-survey, I created 6 educational resources for the caregivers on the following topics: positioning, soothing, torticollis, bottle feeding, sensory regulation, and tummy time. Based on the pre-survey results, nurses believed that caregivers received adequate education on diapering, so I did not create a handout on diapering. After I created my handouts, I reviewed them with the nursing staff, and I had the same nurses who completed the pre-survey complete the post-survey, and I got 15 of those nurses to complete the post-survey. And I asked them the same question, just with the addition of these handouts, how they believed the education would be for the caregivers. And most of the nurses believed that they would receive adequate education on all the topics with the addition of the handouts. And you can see the averages of their responses in this right column. These graphs show my results in a different way. On the left, you can see my pre-survey, and on the right is the post-survey, and the bars just show the averages of the topics, so you can see how the nurses' responses increased with my post-survey. In conclusion, these educational handouts will allow staff to provide consistent materials to all caregivers in this population. My project aimed to develop educational resources that could be implemented into the discharge process of infants with NOWS in the NICU and infants exposed on the postpartum floor. And ideally, these handouts will be integrated into the therapy sessions that the caregivers have with these infants, because there are caregivers who are there throughout the entire stay of the baby. So these can be integrated throughout the stay in the NICU or on the postpartum floor. And for the caregivers that are unable to receive information until the day of discharge, these will go into the discharge folder and the caregivers will take them home. And I was able to work directly with occupational and physical neonatal therapists, and I gained skills in feeding, testing infant reflexes, developmental milestones, assessment, massage, and parent education, and many more things that were very beneficial to my learning. Future work should follow up with the caregivers about their discharge experience and see which resources were beneficial and get their feedback on the resources to make sure that they're comprehensible and understandable and what can be changed for future editing and creation. And I would like to thank my site mentor, Lauren Imhoff, for having a student and for all of her help with my project, and my faculty mentor, Lauren Gurley, and my DCE coordinator, Christine Kroll, for all their help and guidance along the way with my project.